My name is Jonathan Jones. It's my pleasure to be your host and moderator for this afternoon. It's about 5 minutes after 5, and it's February the 22nd, 2026. So we're off to a good start for the year. This month has been declared by the government American Heart Awareness Month. Every February, they talk about the heart. Every February, we talk about the heart. And again, not because we decided that, but because that just happens to be one of the health awareness topic that the government says that we should be giving attention to. And once you hear the statistics, you'll understand why it is a good idea for us to give some attention to it. I think everyone here, I'm sad to say, I think everyone here has been affected in one way or another by this topic. Either we know someone in our family has been affected by heart issues, or we're dealing with something ourselves that we would like to curb. So, but that's neither here nor there. The main thing is what we know now and what actions we can take now. So we're going to be giving you actions that you can actually take right now. So before we get started, though, we're going to let me just put our PowerPoint presentation back up again. So we got some slides that we want to show you, and the slides basically will allow us to kind of guide our discussion and get us talking about things. I'm just going to share with you some of the bad news, and then Dr. Prasad will come along and clean it up for us and give us the good news and that's not good. That's all kind of bad, but here's the good news. And then the great news is that we have quite a few people that can speak to the benefits that they've had with following suggestions that Dr. Prasad has presented, and we're all better off as a result of the suggestions that Dr. Prasad has made. So we look forward to hearing some of those testimonials as well. But keep in mind, by law, we're required to tell you that the FDA has not evaluated the statements that we're making. When you hear testimonials, please understand that they're purely anecdotal. That means that what happens to one person may or may not happen to you. Only the federal government can declare a nutritional supplement to be a treatment or cure for disease. Now, the government allows us to talk about science. So that's one of the reasons why we have to tell you science-related matters. The government allows for that. But we can't tell you or give you the impression that a nutritional supplement will treat or cure any disease. So neither the Healthcare Support Association of America, Engage Global, Dr. Prasad, Jonathan Jones, or any of the authorized representatives, hosts, and co-hosts are making any claims that any of the supplements that we talk about or recommend are going to treat or cure any disease state. So this presentation is for information and educational purposes only. It's not intended to be a substitute for a visit to your doctor. We strongly recommend that you seek the competent medical advice of professionals that you trust. But what did we tell you? We're going to be talking about heart disease. And sadly, it's just a sad story to have to talk about heart disease. But here are the statistics. These are the facts. It's still the #1 cause of death in the United States. Still the leading cause of death in this country. Death and disability. And that's according to the American Heart Association. So these statistics, just pull them today to make sure that we had it fresh. The last time we presented this, the number was more than 700,000. That was up to 2022 now. This is not the 2024 or 2025 figures, but the latest statistics that are available is the 2023 numbers. 915,973. The last time we had this conversation, it was a little over 700,000 that died in the year 2022. So that's a 200,000 person increase. So, and numbers can be made to say anything, but that's just death. That's all that is the number of people who died. So, and if you have a stopwatch, that means that every 34 seconds, a person dies, approximately every 34 seconds. So we've been talking here for about 6 or 7 minutes now, and just do the math. And that's a lot of folks that have expired just since we started this presentation. By the time we're done with this presentation, do the math. Do the math. 60 seconds times 1 minute. 60 seconds is in a minute times 60 minutes. Do the math. That's how many people will die every single hour. Yeah, quite depressing. Well, every 34 seconds. Remember that. So one person every 34 seconds. You got to just kind of modify it accordingly. So here's the next number. High blood pressure and obesity. Those are the top tiers of the risk factors for heart disease. With, as you can see, we're talking with 72% of United States adults being obese. That's an increased risk factor for cardiovascular disease. And high blood pressure, nearly 50% of all US adults are dealing with high blood pressure. No wonder heart disease is still the leading cause of death in this country because of those two things. And it's really sad that these are still problems. If you can go online and Google this and look up the Framingham study. The Framingham study has been going on, still active right now. It's in Framingham, Massachusetts. It was started back in the early 1900s, so it's about 120 years or so of research studying that they've been doing on cardiovascular disease. It's still a current study in place right now for more than 120 years, and still heart disease is the number one cause of death in this country. How can you study something for 100 years and make no progress with it? And why is it that the number of people dying from it is going up? And by the way, this is happening by far. This is not like it's close. It's by far. It's a lot more people dying from heart disease, even from the second one, the follow-up, which is cancer. And we talk about cancer a lot. In fact, we'll be talking a little bit about cancer next month. Women's health. They found that 33% of American women are behind on key medical appointments. Now, again, this is going back to some of the numbers over recent years that folks are just not paying enough attention to it. So there are some gender disparities and other issues that may kind of throw off or skew the issue toward men versus women. As far as men are concerned, I can just tell you most of the time, men don't tend to pay as much attention to their health as women do. So we tend to resist. A good friend of mine, this is about 1.5 years ago now. I'd always been talking to him about his health, trying to get him to get started on Dr. Prasad's formulas, gave him some samples of Dr. Prasad's formulas. He was so excited about how one of the things that it affected, but he just kept resisting. We had been talking about health-related things for years with other products that raised lymphocytic glutathione, and he benefited from it. His wife benefited from it. But I could not get this man to take seriously the fact that he was in that risk category. He was in the risk category. We all are, because even if we have a small amount of visceral fat, and that's the hardest fat to get rid of, we still have a 30 to 40% higher risk of a coronary event, even with a small amount of visceral fat. So we all have potential that we need to be paying attention to, but I could not get my friend to take seriously the need to take Dr. Prasad's formulas. And sadly, his heart stopped. His heart stopped. And by the time the paramedics got there, there was really not much they could do. They worked on him for a long time. And he just didn't make it. So it's very sad. It's frustrating. And I've had more than one of my good friends, but they were all in the high risk category, all dealing with not just some moderate amount of visceral fat. I'm talking obese. So they're in the obese category, and high blood pressure, diabetes, and other things. They just simply, their heart just gives out. Eventually, it cannot keep up with the workload under them, and that's just unfortunate. That's just the way that it is. There's an economic impact of heart disease. There's a huge financial burden on the United States. Currently, the last statistics from the CDC is $233 billion in lost productivity every year. That's the cost of heart disease and stroke. That's the cost. $233 billion a year. They have projected by the year 2050, according to the American Heart Association, they're projecting that cardiovascular disease is going to the cost of treating it is going to reach nearly $2 trillion by the year 2050. Just wrap your mind around anybody talking in the realm of the trillions of dollars of cost for one particular disease. $2 trillion by the year 2050. And think about it. By the time 2050 hits, they would have been studying heart disease for 150 years. So close to 150 years, they would have been studying it, and still the cost is going up to $2 trillion. So I'm not suggesting that maybe some folks have financial interest in it and they're not really looking for answers. I'm not at all going to suggest anything like that. So don't you even begin to think that that's going through my mind, or that I'm implying that in some way. But you kind of scratch your head and say, where is that money going? Who is benefiting from it? So anyway, that just is what it is. A separate study done by Presidential Advisory Projects, all along the same line, just giving you some idea that as to where this thing is going. When it comes to treatment approach for heart disease, the number one thing that's been recommended, and even Dr. Prasad talks about this all the time: lifestyle, lifestyle, lifestyle. Dr. Prasad said, you can talk about that too, you're blue in the face, but people just don't want to change. They just don't want to change what they do, the way that they live. So high sodium, high fiber, heart healthy fats would be critically important. Regular physical activity would be critically important. Stop smoking, critically important. Now, a lot of folks have stopped smoking, but not everyone. Weight management and stress reduction. So even if you could handle the weight management thing, how many people can control stress and get that out of their life? So, but the number one thing, there it is on top. So if you can get your life under control, then you reduce your risk for heart disease tremendously. Then there's medications, and most of the medications are cholesterol related, beta blockers, ACE inhibitors, antiplatelets. Print on my screen is a little bit small, so it's kind of hard to see that. And then medical procedures. So a number of different medical procedures. This is just the common approach to heart disease. And there's a lot of money, as I said, being made in that. You look at the screen, $233 billion is being generated from this screen right here. Most of it in the bottom layer, bottom two layers, as a matter of fact. So that's the skinny, no pun intended. So the reason why somebody would want to choose Dr. Prasad's formula is because of who we're talking about. We're talking about a man here who has a storied background. He was the first radiation biology PhD. This man has decades of research behind his formulas and clinical testing. Decades of research and clinical testing. His formulas, the most scientifically tested products, micronutrients in the world. So when it comes to, addressing the root causes of every disease, this slide here mentions, I don't know why that says thyroid on there, but we're talking about heart disease, and using non-toxic, safe products with no side effects. Dr. Prasad's formulas are right there on the top shelf. They're the top shelf, and you don't have any side effects from them. I've been taking Dr. Prasad's formulas now since, let's see, we're coming up on about 8 or 9 years now. And the biggest side effect I've had from any of his products so far has been, in my first 2 weeks or so, I got a rash. And it turns out that was just detox effect. So I got a rash because toxins were trying to come out of my body. I never had any nausea. I didn't have any other issues. If you drink plenty of water, then any little discomfort that you might experience from it it just goes away. It doesn't last very long. But I've used almost every single thing. We'll show you some of the slides on his different formulas in a little bit, but I've never had side effects from it. I have had less back pain as a result of his formulas. I've got a problem that I was dealing with in my hip that's gone. A doctor said I had a touch of bursitis in one of my joints, an elbow or something at one time. I don't have that issue at all. I'm walking a lot better, a lot more comfortably. So my pain levels are almost non-existent. And last time I had a blood test, the doctor at the lab said he referred to me as one of the lucky ones, especially when he heard that I was over 60. I said, this has nothing to do with luck, doc. This is because of some pure hardcore science. So, and I'm happy to say that I feel healthier today than I did when I was in my 50s. Some stuff doesn't work as well as it used to, but I still feel healthier and full of life, even in my 60s. So, and I'm happy that my family, my brother and my sister are both using these formulas, and anyone else that I can talk into in my family. So I don't hesitate to make sure that folks get to know about Dr. Prasad's formulas because it's no joke. This is serious. And every single day of life is tomorrow's not even guaranteed. So if we're not taking action today, something is working against us. And this meeting is not about telling you all the different harmful ways that toxins are trying to get into our bodies, but let me tell you something, it's incessant. And it's coming from places that you think would just be completely harmless and or innocuous. Everybody reads the side effects on the labels of medications, and we just sort of get numb to that and just don't even think about it. My sister is visiting from Georgia, and she said that she went with her husband to have a procedure done on his eyes, and there was 4 or 5 men there in the waiting room to get the same procedure done. And she said they didn't even know what the procedure was. They had no idea what this doctor is going to be. He's going to burn in their eyes with some sort of a laser. They had no idea what the success was going to be. They were just there because the doctor told them that they needed to have the procedure done. And there's a lot of folks who simply do what they're told and don't even give one thought as to the level of benefit up or down or the consequences of their actions. But you folks are here because you want to know more. You want to know, is there something else that I don't know? And let me just tell you something. You don't know what you don't know until you know what hasn't been told. And there's a lot of stuff that has not been told. A lot of things that have not been told. So we're going to be pushing out a lot more information about what's in our food. So if you care to have information like that, then just subscribe to my YouTube channel. And by the way, for those of you who are on YouTube right now, thank you for joining us. We appreciate that you're there. And please like, subscribe, and share so that other folks can get this information, and so that YouTube gets the message that this content is relevant. But we're going to be pushing out a lot more 3, 4, 5 minute videos with specific information, giving you knowledge about what kinds of foods to avoid and what kinds of things to choose if that's what you're looking for. But we're going to introduce Dr. Prasad to our discussion now. And so, Dr. Prasad, we can't thank you enough for your being willing to join us in our discussions like this almost every week. And I'm going to say almost every week because we really don't want to put that kind of pressure on you to force you to work any more than you have to. But the audience, you're looking at Dr. Prasad's credentials. I'm not going to go through that right now. Take a screenshot of that, please, and then you'll know that this is not just some college student that graduated hoping to be a product formulator. This is a man whose life has been dedicated to research and science, and that's the one who's producing these formulas. He is successful at the highest level, published nearly 300 times in peer-reviewed publications, invited to be on the Nobel Peace Prize nominating committee. Are you kidding me? Professor, University of Colorado School of Medicine for 30 years. He's taught doctors. He's forgotten more than most doctors know on the subject of nutrition and micronutrients. And so this is the man, the mind behind the formulas that we have at our disposal right now. So again, Dr. Prasad, thank you so much for joining us, sir.
Thank you, Jonathan. Every Sunday, I enjoyed being with you, and also being with Engaged Family. And whatever I can help, I'm always there to help you.
We're excited. We stay excited about it because it's
anybody has any question as we go along later on, I will be glad to answer it if I can.
Good. Those, I think some questions are going to come up, and we're going to try to make sure that we allow a little bit of room for that. But maybe Dr. Prasad, you can tell us. I just threw out all that bad news about
Yeah.
how horrible heart disease is, but is that the end of the story?
Well, I think it is kind of not anymore if we follow what we are going to discuss. That this has been, for example, right now there is no effective prevention of heart disease in the marketplace. What is there?
No treatment, no medication that's an effective
No, that's it.
prevention
Medication
for it.
can. And so
Wow.
only thing they have been advising for years, several decades, good diet,
Yeah.
good lifestyle,
Yeah.
exercise, and also reduce exposure to environment pollution. This
Hmm.
has been known for a
Yep.
long time. But the question is, these have not have a slightest effect in the incidence of heart disease. It is increasing, not because many people don't follow. Some people can't afford good diet lifestyle.
That's
Some
right.
people can afford it but don't follow it. So it is not the fault of the diet. It is a good idea.
That's right.
We always say that whatever we recommend in terms of a supplement, you always have a good lifestyle and this kind of stuff. So, but main reason why it failed totally, that kind of things that I mentioned, people don't follow it. And second, that it may not be as effective as they claim to be to prevent the disease, but must be even 10% decrease in prevention would be very good. But anyway, but the main reason why it failed, has failed so far, that the current prevention strategy that we propose officially, unofficially, is that it does not address how to attenuate, how to decrease the internal causes of these symptoms, heart disease.
Hmm.
Internal causes, none of them have. For example, all these external factors that you mentioned, they increase free radical production. That's the first steps.
Yep.
When
Yep.
that happens, that increases inflammation.
Yep.
So now you have increased oxidative stress and inflammation, which initiate all the events later on, which leads to the heart disease.
Hmm. Hmm.
And so I think until you reduce these two at the same time, together with the all changes in the lifestyle and diet and exercise and so on, it is not going to work. So how do you do it? It's a very simple question.
That is the real question, Dr. Prasad. What's the best piece of advice that we can give people?
Yeah. So many people say, that, oh, some people say, oh, I take antioxidant. But
Yep.
what kind of antioxidant you take? Taking antioxidant generally means reduce oxidative stress and inflammation. But in our view, it is the antioxidant can reduce some place oxidative stress, but it may not increase the oxidative enzyme, which is also important.
Mm.
Our is the only micronutrient formulation which can increase the antioxidant enzyme and antioxidant compound at the same time. And these two are very important ingredients to reduce oxidative stress and inflammation at the same time. This is very important. You can take a few multiple vitamins, they might decrease some oxidative stress
Right.
compound, but it may not increase the antioxidant enzymes. And then increasing of the antioxidant enzyme is absolutely essential for reducing oxidative stress and inflammation at the same time. And so,
Antioxidant enzymes, Dr. Prasad. I
yeah,
thought antioxidants were antioxidants. There's a separate thing, antioxidant
so no, not
enzymes.
all antioxidant does it. Or not all antioxidant will increase
Wow.
the antioxidant enzyme. Only certain antioxidant does it.
Hmm. So
And
you've
so,
got a mixture of them in your formulas.
so in my formula, we have mixed in a way that we have tested it. Increase oxidative stress as well as increase antioxidant enzyme.
Hmm. Powerful.
And
That's
and increasing antioxidant is a complex procedure. An antioxidant that we have has to increase what is called a Nrf2
Yes, yes, yes.
You see, this is a molecule that is very important because if you don't increase Nrf2, then you will never increase antioxidant enzymes. It is a
Okay.
complex pathway.
Now, see, I've seen reference to Nrf2 all throughout the science brochure. In
Yeah,
fact, there was about four different things, four or five different elements that you have in micro daily alone that have
yeah,
an impact on Nrf2.
yeah, exactly. Because sometime in a chronic diseases, Nrf2 generally Nrf2 is very responsive to reactive oxygen species or oxidative. A small amount of free radicals needed it. But what happens later on, they become very resistant to the normal way of increasing. But then there are only certain, not all, certain antioxidant can only activate nerve 2, activate nerve 2 when they become resistant to normal stimuli. So if you don't have the right kind of antioxidant in your preparation, then Nrf2 is not going to be activated because it has become resistant to normal stimuli and the normal agent that can stimulate activation. And so you will not get the maximum advantage.
Wow. That's pretty impressive. I'm going to bring that screen up as soon as I can find it. We may share a testimonial, but I want people to see it's right there in the science brochure,
Yeah,
in the original formula, because one of the patents that your original formula was awarded was for heart health.
yeah,
So, I mean that's pretty significant,
yeah,
for any kind of a product. Okay, wait, I see a screen here. I'm just looking to see if I thought I saw it real quick. That paragraph featuring, anyway, I'll find it. But to be given a patent for pulmonary and heart health,
yeah,
so that's powerful, Dr. Prasad. So we still have access to all of this down to this day.
yeah.
So that's micro daily primarily, right?
Yeah. So it's the current treatment of heart disease. They treat the symptoms of the disease,
Okay.
not the causes. And causes, one of the major causes is increased oxidative stress and inflammation. Doctor never recommends that you take anything to reduce oxidative stress inflammation. But some agent in a heart disease, they have improved the lifestyle. But many times quality of life has not improved because some of those medications have a toxicity. So the current treatment of heart disease has improved, prolonged the life of the individual and has been very effective, but has not saved from dying or uh,
No.
reduced the rate of the disease progression. It is because you have not addressed the causes of the disease. You have symptoms. So symptoms is all under control and you have a good quality, reasonable quality of life, but nothing stops. It keeps progressing.
Well, Dr. Prasad, they keep focusing primarily on cholesterol, like cholesterol is the only answer.
Yeah, cholesterol, sometimes the anti-cholesterol drug is one of the major one. And then you have also this blood clotting, anti-blood clotting,
Yeah,
and
yeah, yeah, yeah.
uh,
Yeah.
those
Well,
those medication can be very dangerous, can be increase the bleeding. So, but they have done for some people, they have increased, but still they die earlier. They would have
that's
died
exactly right.
otherwise.
That's exactly right. I just found the page in the science brochure that I was looking for, Dr. Prasad. I can't seem to write on my screen right now, but there it is. Vitamin E succinate activates Nrf2, crosses the blood-brain
Yeah,
barrier.
yeah, yeah,
Then you've got CoQ10 activates
yeah,
Nrf2,
yeah,
improves energy. Alpha lipoic acid activates Nrf2.
yeah,
N-acetylcysteine activates Nrf2. So you got all this stuff in here.
yeah,
So this is really all about the antioxidant enzymes, not
yeah,
just putting in antioxidants in the body and think it's going to do its job.
exactly, exactly.
Oh my goodness. See, and we thought we
Not
had
many
heard it.
people, not many people think about that the nerve 2 contribution or antioxidant enzyme contribution to reduce oxidative stress and inflammation.
Well, Dr. Prasad, it's not exactly the kind of thing you talk about over tea. We
Yeah,
don't. No one hears this. I'm now, mind you, I heard Nrf2 was good as far as telomeres was concerned and anti-aging, but I never connected it to this to antioxidants and things. So you've kind of
yeah.
blown my mind when it comes to this right now, Dr. Prasad. So thank you for keep continuing to take us
Look,
to school.
I'm 91 and I'm still functional nicely. I still work,
Yes,
published
sir.
paper, published book.
Yes, sir.
It
Yes,
is
sir.
because
You are.
what we are developing, I'm also eating, same thing.
Yeah, some of us still wonder how in the world you managed to do that, sir. We do. We
Yeah.
wonder about that. Um, I'm going to show you. There's this. This is the other product that you produced, the Heart Boost formula. I don't
Yeah.
think there's any special going on with that right now, but let me just see. Yeah, there it is. Heart Boost. Why did you come out with Heart Boost? With Micro Daily is so good. Now, mind you, I love this. I take this every day. And because I
One
want
of
my
the major
arteries.
problem is in a heart disease sometimes is a lack of blood supply, enough blood supply to the heart.
Okay.
And so we decided that maybe we can put it some agents that can increase the so in one of the major uh, effect of heart boost is the increase of the blood flow and vasodilation. And so that's I forgot all the things that I have added in that
Yes.
because it has been so long. Yeah. And so you can see that it is there. But two things was this harbus, yeah. The root beet roots
Yeah,
is
that's phenomenal support
that
for
beetroots,
the heart, circulation, kidneys,
yeah.
everything.
Yeah. And so that's very good. And rest of them, some of those herbs are very important for maintaining the heart health. Reducing oxidative stress, inflammation, by different way. You see what I mean? They produce,
Gotcha.
for example, some of the herbs produces reduces the production of a stress hormone, cortisol. That's very important.
Yes.
Stress is one of the most important contributor to almost any disease, including heart disease. Stress. How do you control stress? Well, there are two ways. One is we are adding some of these herbs, we'll do that because it reduces production of cortisol. And also, what do you call CBD
Yep.
is so important. And so many times people who have a heart disease also have anxiety, also have depression. And those people I recommend, in addition to Core 4 that I recommend and Heart Boost, we also recommend that you take collagen peptides.
Okay. Okay. That's good. I was hoping that I had a one of the slides
And
here of
another thing is
CBD.
that if you have high blood pressure, suppose you are taking medication and everything, and you can't sleep,
Right.
high blood pressure prevent nice sleep. For those kind of people, we have developed a sleep boost.
That's right.
So the question is, for your health, yeah, suppose if your heart, we are concerned with heart disease, yeah, whatever we are saying, follow that. But then, suppose many times, despite the best treatment you can have, still you can sleep for other reason because you are thinking about relationship, about something, financial issue, can't avoid it.
That's right.
And that kind of, you have to force brain to, can't force brain to not to think, but the consequences of that thinking can be blocked.
That's
For
right.
example, the CBD will increase the serotonin level in your brain, which is lack of serotonin can make you life miserable. Stress increases, anxiety, depression increases. But if you have good level of serotonin, you don't have to worry about it.
That's
Second
right.
is that it also increases the dopamine level in the brain. And dopamine level brain makes you very happy. And third, very important, it is non-toxic, non-addictive CBD. It also reduces the production of glutamine, glutamate, not sorry, glutamate, which makes you hyperactive, anxiety, and so on and so forth. So you can see a simple molecule can do all these things at the same time.
Wow. Yeah, no, that's pretty powerful. I've
So,
got
so we
a
have developed a program depending upon your health conditions. Some people have heart disease, but also have some other issues. You know,
well, all these other issues can be contributing to the heart disease.
yeah, yeah.
So
And
these are
so I
lifestyle,
think, but what I said that many times say that I can't afford it, for example.
right?
Basic thing is you take micro daily EMF, either hydro or capsule, and probiotics. These two are absolutely essential if you
Right.
can't afford it.
Right. Yeah. We're going to talk about. I'm going to tell everybody about what their best combinations are
Okay.
price wise, because so many folks are dealing with issues like that, and there's a lot of legacy affiliates here on the program that can guide their folks, their guests, to getting some resolution with that. But let me do this, Dr. Prasad. There was an interesting testimonial last week
Sure.
on the program, a gentleman whose heart function was down to some ridiculously low level. And he started using your formulas or was assisted by your formulas
Hmm?
and saw some pretty major improvements.
Hmm.
So I think I know where it is. I'm gonna see if I can find it here real quick, Dr. Prasad, and see if we can't get that up here. I mean, Jeff may have it already at his fingertips. And Jeff, if you do, we'd love to hear that story. But I think it's right
Yeah, I
here.
have another. I have one testimonial that I did not witness it, but my friend in India witnessed it. So my friend in India asked me that his father has a heart attack. Now he's lying in the bed. He can't walk. He can't. What happens after heart attack. And so I suggested what we suggest every day, Core 4, and he tried it, and he said after 2 weeks of taking it, now he's walking, he's happy, he's walking and talking. I said, I mean, sometimes this data I can't believe it. I'm surprised. After a heart attack, when he was not able to walk, he was not able to talk nicely, and so now after 2 weeks, and so he was very happy that I helped.
Yeah, Dr. Prasad saves the day again. All right, I think I have it here, Dr. Prasad. Let's see if this is the one.
Yeah,
Uh,
okay.
The according to the timestamp, it was supposed to be at 24 minutes here. So let's see if it's here.
Okay, the Gaddy family. Can you go ahead and turn on your camera, or do you want to just share with us? It'd be great to be able to see you.
The camera's
Um,
not working right now, Jeff.
okay, all
Yes.
right.
Am I unmuted? Can you hear me?
We can hear you. Yes, yep,
Yeah.
you're right there. I'd love to hear from you. Okay, thank you.
I
Go
just
ahead.
wanted to give this experience about the with my husband. We've been, doing the micro daily, and we, been trying because financially, or they do it full blown. But my husband has been on the uh micro daily EMF hydro, and we wasn't aware of his heart condition. But recently, he had to go to the hospital, and we found out that the doctor said that his heart fraction was regulating at 15%. So we thought, what? That can't be possible. So anyway, we said if he's 15%, he should be in intensive care. All kind of tools should be running through him and everything. But he wasn't. But so we asked. So the doctor came and he said, "Well, I'm going to do another ultrasound, and see what's really going on." And so he did ultrasound, and but what had happened was the 15% was back in 2019 when he had an episode. No, he said, does he have a heart doctor? And I said, no, he doesn't really go to a heart specialist because we haven't known that he had a heart problem. So his doctor wasn't recognizing it. But anyway, long story short. So he said, I can't believe it. He says, how did that happen? I knew how it happened because we have been taking, the EMF hydro for a couple of years now. But he said, 60%, that's great. He said, but you can't get to 100, but 60%, he said, I don't know why he said because it was 15%, he should have been taking, ultrasound every year. But he wasn't, and he was amazed. He said, well, his heart is good. The heart, he says, you got a good ticker going there. And my husband, let me tell you, my husband is 82 years old. So that was really, and I just wanted to tell that about him, that EMF, I said, thank you, Dr. Prasad, that EMF really helped him get there because he wasn't taking any heart medication or anything like that.
Wow.
Thank you.
Dr. Prasad.
Thank you.
She said he wasn't taking any heart medication. He went from 15% and was only on EMF hydro for 2 years.
Yeah.
Now he's at 60%.
Yeah.
Okay, well, I don't know about the rest of you guys, but look, I want my Nrf2 activated. So I'm gonna stay on Nrf2 activation therapy. So because that's the story I want to tell when I hit 82, that my heart function. I mean, I don't want to be at 60%. I want to be at 99%.
Yeah.
So with mine, so that's mind numbing to me, Dr. Prasad.
Yeah.
To hear this,
I think that's amazing. I mean, if you look at, but if you look at what are causing these things and how these nutrients affect it, then you said, yeah, you expect it, but not to that level that we are hearing it from all over the place.
wow, yeah, no, that's mind numbing, Dr. Prasad. So no, and it's great to hear. So for folks who are here now that are wondering, what is the suggestion? I'm going to just show you real quick. Dr. Prasad talked a little bit about the different formulas that he has, and then we're going to try to leave room for a few of your questions. So I'm going to back up just a little bit here, so you guys get to see it all. So first of all, the heart boost.
Yeah.
So anyone who's dealing with blood pressure issues and need a little bit extra, make sure you add this to your formula. I don't have blood pressure problems, never have. I take 2 of these every day, personally. I take micro daily. I take double doses of this every day. I take 6 of them in the morning, and I usually take 4 or so at night before bedtime. So I take this very seriously because I do not want to have any heart issues. So probiotic boost. Now, my wife loves the probiotic boost. She has to take a couple of those every single day to support her gut. I'm at a point now where my microbiome is pretty stable. So I take maybe 1 or 2 a week of the probiotic boost. The digestive boost, my wife takes every day. She takes digestive support. So that's important. Collagen daily, I take it. And by the way, the reason for the digestive boost, for those of you who are wondering, especially as we become seniors, we start making digestive enzymes less. So our body doesn't make them as well. So we have a harder time breaking down food. So if you're still a carnivore like I am, you might want to make sure that you take 1 of these or so 10, 15 minutes before you eat, 30 minutes before you eat, or after. Either way, it's like dropping teeth in your stomach. So it will help to break down whatever's in your gut. It has a phenomenal digestive supporting capability to make sure that everything you eat, because none of us chews enough. We don't chew enough. And so that is where part of the problem comes in. But this helps to compensate for what we don't do with mastication. Collagen daily, I take 1 of these every single morning. I put it right in my green tea. Our body's made up of collagen. So this is good for the heart too, Dr. Prasad. So the heart is made up of collagen.
Definitely. Yeah.
Yeah. So this is outstanding for keeping our organs nice and youthful, right?
Yeah.
So
because one of the major function of collagen is to maintain your structural integrity and functional integrity of all organs, including heart, brain, kidney, you name it.
Okay. So I stick with that one. I will not deviate from that at all. Omega-3, I take a bunch of this every day. So I take 2 of these 2 or 3 times a day.
It is very important essential amino acid. Your body don't make it. You rely totally on diet, but you can't take fish every day. And so this is the best solution to take micro daily. And another unique function of micro daily for some people, for example, patients with diabetes sometimes become resistant to all medication, including insulin. and there is no way to make use the glucose,
Yep.
metabolize it. But omega-3 is the only place I know of which can activate directly, bypass the insulin receptor. Because normally insulin receptor job is to activate the AKT. But if it is oxidative damage already, so it is not doing anything. So omega-3, omega daily is the only agent which can directly activate AKT molecule, which is a messenger molecule, and he sends the message to the glucose transporter, which are lying in the cytoplasm idle, to
Yep.
migrate to the cell surface membrane and allow glucose to come inside the cell.
See, that's mind-boggling. I think every time we hear it. And I think for you folks who may not have understood Dr. Prasad's science statement that he said made right there, listen carefully. Omega-3 opens the cells and lets glucose in just like insulin does.
Yes,
It does it independent of insulin.
that's correct.
So, like if I eat something extra that I'm not supposed to eat, I make sure I eat 1 or 2 of these right afterwards, and I don't get that sluggish feeling, Dr. Prasad.
Yep.
I've noticed that the sluggishness after I eat something I'm not supposed to isn't there. So it's opening up the cells and letting the glucose go in the cells and giving me energy instead of loading me down, weighing me down.
Yeah.
So,
And another thing is omega daily. Omega-3 is a fatty acid, and therefore it is very easily damaged by free radicals. So if it is a damaged molecule and it is so important for the brain and so important for the heart, until you supplement them with a regular, healthier omega-3, your brain and heart won't be functioning good.
that's what I'm talking about. This one here is a must. I will not take this one. So there's several of your formulas that I don't miss a day on. We're not going to spend a lot of time talking about the GLP-1, but listen carefully, folks. This one, along with the collagen peptide, is the absolute winner as far as activating GLP-1 and GIP. Okay,
Yeah.
so that's your winner. This is the one here, Dr. Prasad was basically saying that if you're on a budget, and the most you can do, the absolute minimum he wants you to do is this basic bundle right here. So at the very least, Micro Daily and the Probiotic Boost. But you can get back with the person who advised you, and they'll tell you about all the different bundles and help you to figure out which way to go for you. Dr. Prasad mentioned CBD Boost, great for stress, great for anxiety, also extremely positive and very supportive for those who are having heart issues. Brain Boost, I don't go a day without that. Sleep Boost, help improve your quality of sleep, all very good for a healthy heart. This is the core 4 that is the basic, the core 4. These are the core 4 right here. And then you can build from this basically. So you talk to the person who invited you and they'll help you to figure this all out. The retail cost for this, for each of the items, would be about $310. If you focus on just the ingredients, it would be in the $1,500 range. But Engage Global has subsidized our health. So wholesale would be about $250, but this bundle is only about $205 per month if you buy it as a bundle. So that's $50 below the wholesale cost. So if anyone is looking for a deal, this is your deal. Engage Global really wants everyone to be healthy. So again, just get back with the person who invited you to this discussion, and they will guide you. And just one last piece of advice before we take a couple of questions here is take your heart health serious, folks. Don't become a heart statistic. It's happening right now as we speak. Remember, the math was 1 person every 34 seconds. So that's roughly 2 persons every single minute of every single day. So in an hour's time, since there's 60 minutes in an hour, divide that in half. That's roughly 30 people that have died in an hour's time from heart disease. And that should be unacceptable for anybody's numbers every single day. But don't expect a pill, potion, or lotion to do for you what you can do for yourself. We strongly urge you, please, folks, get moving, and take charge of your health, and you'll be happy that you did. Your body and your family, everyone will thank you because you've done something for yourself to put yourself in a better position. Now, I noticed there's several questions that came up in the chat, Dr. Prasad.
Okay.
So one of them I think is kind of be great just to get your comment on. I think Bernard may have a couple more here, but there's one that I really want you to give to comment on because I was dealing with the issue with this this person for quite a bit of last week. It has to do with potassium. Now, the person has advanced CKD. They got chronic kidney disease issues, and their potassium levels tend to be very, very high. Is there any reason why they should not take micro daily or?
No, potassium level is high, but how about sodium level?
Kay, can you tell us anything about sodium levels?
Because sodium and potassium are very linked. Excess sodium can cause blood pressure.
They didn't mention they're online. So if you could answer, Maria, the sodium level. Unmute, please. Is it high?
Let me see the blood. Hello, everyone. Let me see the blood work that I sent you about the sodium. His his blood count is 2.47 is low. Hemoglobin is 8.2. Hemometric is 25.3.
But does it say anything about what his sodium levels are?
Hold on, I'm going down. Hold on. And let me see, sodium.
But microdaily
potassium and phosphorus are high. Glucose, creatine, GFR. I don't see. Sodium. Sodium is right here. It's 135.
Does it indicate whether that's within range?
It ranges 135 through 146, so it's in the normal range.
So the sodium is in the normal range, Dr.
Yes,
Prasad.
yes.
But the potassium is high. Would microdaily have any impact on raising potassium levels?
Well, there is no data, but I think worth trying it for a month and 2 months and get blood tested and see if it reduces potassium level, because that is very unusual to have sodium low normal and potassium is high until you are eating a potassium-rich diet,
Right.
He was on he was taking a blood pressure medication that raised the potassium level.
Oh, I see. That might have been plays a role.
The blood
So
pressure.
I think we don't have a data, but I would say that micro daily generally for your health, and if it is might have some effect in terms of reducing the toxicity of medication that you are taking, and this may be one of the expression of toxicity, selective increase in potassium. I don't know.
Okay, we cannot give him any liver because of the vitamin A content. They said it can be the toxicity in his body. So I just noticed that microdaily have like 900 mcg rate.
Oh, yeah.
And he drinks the pills and the powder. So, and he's been extremely tired. I don't know if it's you think the vitamin A accumulated in his body?
No, but that is required, that is absolutely needed. I have given that amount which is a minimum amount recommended by government to take every day for human.
Okay.
So it is not a high dose at all. And 900 microgram is about the 3,000 international unit, and it used to be 5,000 international unit, but they have decreased to 3,000, and we decrease it proportionally. So right now, our level of antioxidant, I mean vitamin A in our micro daily is the amount required for your good health, approved by the FDA and
Yes,
everybody
yes.
else.
Even if he had a kidney failure.
Kidney failure or any, it doesn't make difference. It
Okay.
is needed for your body function.
Okay. And what about the collagen? He's been drinking every day.
Collagen is only place I say don't take collagen is
Okay.
if you have a cancer.
Oh, no, because of the protein. That's what I'm thinking about.
No, collagen is extremely important. As I
Okay.
said,
For the organ.
Okay.
yeah.
Wonderful. Thank you so much for my
So,
question.
And we'll circle back again and have a chat on that too, Liz. So thank you very much. And thank you, Kay, for bringing the question in. We'll take one or two more here. Bernard, Bernard's one of our co-hosts.
You know what I'm going to do is I'm going to yield to the ones that are on here, but
Okay.
I really appreciate the parts about the heart. I've been a American Heart Association. I've been a CPR basic life support trainer for a number of years. And for those of you that are on here, I have had some people that were due for heart procedures that started on the micro daily or the core four. And all of a sudden, next thing you know, they went to their doctor and the doctor said they no longer needed those procedures, which was huge. And of course, lately we've been having some people on with heart transplants that are wondering whether the core four will help them with their transplant. But I'm going to, like I said, yield to these people that are on here because this heart is really, I mean, without a heart, without your heart operating, you cannot get your nutrients all the way to the extremities of your body. So
yeah.
this is super important for everybody that's on here. So I'm gonna yield to the other ones.
Thank you very much for your comments, Bernard. So Val, go ahead, please.
Question, Dr. Prasad. I have someone who has LVH, left ventricular hypertrophy. Can the EMF and heart formula help with that?
But can you repeat the
Left
Left-
ventricular hypertrophy, LV, yeah, left ventricular hypertrophy.
So a serious left ventricle disease, Dr. Prasad.
Yeah, I mean, again, those kind of heart disease, specifically symptoms, I don't know. But at least if you take a core 4, it will help it, or it does not interfere, it would not make it worse. So the worst thing would be it has no effect, and the best thing would be that it might reduce it. See, some of these diseases we have not experienced with, in terms of a treatment. And so what our job is to provide the information, and your job is to consult your doctor and see if it is okay.
There we go.
I'm not a doctor, as you know. And so my job simply is based on science. I suggest people this is for your good health, whether you have a disease or without disease. And then I say, you consult your doctor, and if they approve it, you do use my suggestion. If they say no, then it's up to you.
There we go. Thank you, Val. Appreciate your asking the question. Go ahead, Sonny.
Okay, so I started Micro Daily, I guess maybe almost a month ago. And in 2023, I had COVID twice and COVID pneumonia, which started my heart issues. So at first my infection rate was like in the 20s. Last month it dropped down to 12, and that's when I found out about this product. I was already taking something to increase my glutathione, which I think really helped my muscles and everything. So I just want to make sure I'm taking enough of everything. They just increased me to 3 of the Micro Daily Hydro EMF. I'm taking the probiotic twice a day. I'm taking the Heart Boost, the 2 capsules, and omega-3 twice a day, and the collagen once a day. I'm still having problems with inflammation and having to take my diuretic, which gives me a lot of problems as far as muscle cramps and everything. So is there something additionally I can do to offset the problems from the diuretic?
Well, how long you have been taking this product?
About a month now, maybe a little over a month.
Yeah, that's too soon. But right now, I would not suggest it, except maybe you like to take a CBD. Do you feel sometimes anxiety or depression or worried about it? Do you worry
I
about
don't
your?
sleep well either, so I would just notice you have a sleep boost, and CBD is for stress and anxiety.
And will
Yes,
help you to
yes,
sleep. So take the sleep boost and take the CBD boost at
very
night.
much. And then let us know after a month how you feel.
Yeah, because I'm scheduled to go to the center in Chicago in April 8th to be considered for a heart transplant. So I'm really interested in getting all this working better by the
Information.
time I go.
And when you go there, sometimes doctor might say that you don't need a
You
transplant.
don't need it.
Right. Or I may be way down the list, and this will give me a chance to
Yeah.
come off the list.
That's right.
Yeah,
It's
I
my
don't know.
prayer. Yeah.
It
That's
has,
right.
in a couple of cases, it has happened.
We have had
Okay.
that happen. I have a
Even
client,
in case of kidney transplant, there was one or two.
well,
And heart
Dr.
also.
Prasad, I had one that her EGFR number was was down in the toilet. And just on microdaily, her number went through the roof. Has had no heart disease problems since.
Great. All right. Thank you so
You're
much.
only 1 month. I mean, you are having
Yeah,
this
you're
kind of
just getting started.
Yeah, I have a
That's
month too to go before my next echocardiogram. All right. Thank you so much for being here.
Sure.
Thank you, Sonny. Go ahead, Greg.
Hello, good evening. I used to take the Micro Daily a couple of years ago, and I actually still have some of the Micro Daily left. But recently I had a transplant for my kidney, and I just wanted to know, was it smart to take? I didn't know what to take right now for the kidney because I take rejection medication. And
Yeah,
so
you know,
go ahead.
one of my friend, Dr. Bill Cole, has a kidney transplant, and his doctor said that you will have about maybe 17 years, and after that, nothing you can do. And he survived more than 30 years, and he was taking a just micro daily, nothing. All those things are not because, and then he died. So by the time I develop all these new product, so I would say you take a core 4 and then see how it goes. I mean, the only thing I say important thing is to maintain a kidney function. And every month or every 3 months, you must have a blood test done, and that reflects EGFR that have there, and that tell you. And so, it is hard to tell transplant because we don't have any experiment under doctor care. But what we say that increased oxidative stress and inflammation is involved in every disease. So anytime you reduce it, you improve the health of all organs.
Okay. Quick, one more question. My wife wanted to know about glaucoma, what she can take to help her with that.
Eye boost.
Eye boost you have?
The core 4 plus eye boost.
Core 4 and eye boost.
Yes. You will see a dramatic change. My wife has a same issue, very high pressure genetically. And she was taking a drop from the eye.
Yeah, she does
Once I
that now.
developed the eye boost, she started taking eye boost, and now he's 14, 15. And my son, Che, who is a doctor here, and he has a genetic glaucoma, and because he inherited from his mother. And I used to have 18, 19, and he was not taking any medication. Once he started taking a sleeping boost, dropped to 14,
Eye
15.
boost. Right.
Yeah, I got it.
Even genetic, which I didn't expect it one.
Yep.
Just to let you know too, Greg,
Thank you, Greg.
could not drive. My wife could not drive at night, and she started taking eye boosts, and now she drives at night without her glasses.
Yeah,
So it really does work,
yeah.
and also you get a discount when you order that with your bundle.
Guy, I have to go.
Okay,
Yes.
great.
I have
Thank
a
you.
father
I
and
know
son.
we are right at the limit
Thank
here.
you, Doc.
So Linda and all the other hands, I apologize. We're gonna have to bring your questions back on for next week if you guys don't mind.
I can take one Linda question. She's there.
Okay. All right. Linda, go ahead.
Hi, Dr. Prasad. I just want to ask you if there's I take the core 4, and I just want to know if there's anything that I would take that would help with factor 5 lydine.
So what is that in addition?
Of factor 5 lydine.
Factor 5 lydine, is that a supplement?
No, I have too much fibrin in my blood. So
Oh,
I'm just,
fiber, yeah. I
Yeah.
think, if you take, in addition to core 4, how long you have been taking?
about a couple of months.
Oh, yeah. So, you will see that, in increased number of fiber, I think you will go down because all these are related to oxidative stress. So give her another 2 months and then let us know. And then I will think something about that, do some more research and find out if anything else can be done.
And of the micro daily, should I take therapeutic dose or?
Core 4 is important.
Okay,
You take core 4,
yes,
then that's all. But but if you have some worried about anxiety, you take CBD. That's
okay,
all.
okay, thank you.
Sure.
Thank you very much, Linda. So, Dr.
Jonathan, I'm
Prasad,
just going to jump in here and just say this. You don't expect something to happen overnight with these products. Whatever the issue is that people have had, that 90-day requirement is very
Yes,
essential. I
I'm
had to
glad you
jump in
brought
here
that.
and state that.
Yeah. Thank
I went 4 months before I take the eye boost, but trust me on this. If you have an issue, you got to give it at least a minimum of 90 days.
Yes.
I had
I'm
to jump
glad.
in on
Thank
that,
you.
Jonathan.
thank you very much, Glenn. You're a good man. Appreciate it. Dr. Prasad, we cannot thank you enough, sir, for being willing to
Thank you
join
all.
us in discussions like this. Thank you, everybody, for joining us. We'll see y'all next week. Very amazing discussion we're going to be having next week, cancers and other things. So we'll check the calendar with Engage, and you'll see what the topics are coming up pretty soon. Dr. Prasad, thank you again. Have a good night, everybody.
Everyone.
Thank you.
Thank
Thank
you,
Dr. Prasad.
Thank
Thank
you.
everyone.
My team 615. My team
Good to see you,
615.
Jonathan.
All right, everybody.
Bye-bye.
All right.
Bye.
Great call, Jonathan.
Calendar is that?
Thanks, Sister Levette.
What calendar is that?
Calendar.
Good seeing you, Greg.
I am
Good
new
seeing
on
you
the
all.
Thank you,
program.
Dr.
We
Prasad
gotta
and
call
Jonathan
you.
Jones.
Engage Global
family.
Calendar. Get back with the person who invited you, and they'll tell you what the topic is for next week. There's always on the calendar on Sundays.
Okay, thank you.
No, thank you for joining us.
Okay.
Thank you, Jonathan and family, Dr. Prasad.
Thank you, everybody.
Thank you from the Schumacher family.
I just wanted to say too how good the eye boost was for me. Very good. My eyes are back working now.
Wonderful.